SNRIs, or selective norepinephrine reuptake inhibitors, are a class of antidepressants that increase the level of norepinephrine in the body. Examples of SNRIs are desvenlafaxine, otherwise known as Pristiq, and duloxetine, also known as Cymbalta. Others include venlafaxine, brand name Effexor, and levomilnacipran, commonly known as Fatsima. SNRIs first appeared on the market in 1993 with the introduction of venlafaxine in response to research indicating that serotonin could improve depression and anxiety without creating significant anticholinergic effects. This class of medications works by forcefully inhibiting the reuptake of serotonin and norepinephrine and mildly inhibiting dopamine reuptake. These medications are taken by mouth and are typically taken in the morning due to their potential side effects. They are best taken with food to reduce the possibility of developing nausea.
They're usually prescribed for major depressive disorder, generalized anxiety disorder, and sometimes for chronic pain like diabetic neuropathy, chronic back pain, and fibromyalgia. It is important to educate patients that the onset of these medications may sometimes be as long as 4 to 6 weeks. So it's vital that the patient remains consistent with medication adherence. There is a lengthy list of medications that interact negatively with SNRIs. Some of the most important ones are mixing with tricyclic antidepressants, or TCAs, and monoamine oxidase inhibitors, or MAOIs.
Mixing with MAOIs or other types of medications which increase serotonin in the body can cause a potentially fatal condition called serotonin syndrome, in which there is a life-threatening buildup of serotonin. It is important not to take these medications if there is a known drug allergy, severe renal or hepatic impairment, if there is pregnancy or lactation, or simultaneous use of MAOIs, even if the patient stopped taking these medications up to 14 days ago. When taking SNRIs, the patient must be monitored for hyponatremia, especially older adults, for weight loss, increases in blood pressure, and for hepatotoxicity. The patient should be taught about the symptoms of serotonin syndrome, including restlessness, confusion, tachycardia, and loss of coordination, and instructed to go to emergency care if these symptoms present.
Some of the most common side effects may be nausea, headache, sweating, increased blood pressure and heart rate, increased risk of suicidality in children and adolescents, and serotonin syndrome. The patient will need to be reevaluated to assess the medication efficacy. Some of the things to be noted would be verbalized improvement in mood, increased hopefulness and will to live, ability to perform ADLs, and improved sleeping and eating habits.